The service is open to anyone over the age of 18 who has a substance misuse problem, so that includes both alcohol and drugs. And we get a number of referrals from GPs primarily, because a lot of the work in Penrith is shared care, but an idea of others is probation and other third sector organisations, and obviously self-referrals.
We do substitute prescribing for substance misuse clients. We also offer acupuncture. For alcohol clients, we offer counselling and solution-focused therapies, and we have an alcohol support group which is just about to start now. Especially like an alcohol support group, we always keep make sure there's some stronger members who are doing well in recovery to support the ones who are struggling, and that works really well. You know, that's like a role model.
Well, I was a heroin addict. I've been caught by the police a few times carrying heroin, and I got sent here from the police station on a DRR, which was where I met my counsellor. My counsellor Paul's been great. He was a great help. I wouldn't be where I'm at now if it wasn't for him. A fact of that he used to be an addict himself was a great help. It's that connection that you have. It's a great help indeed. You've got something in common. Helped us realise a lot of things. Couldn't see what I was actually doing wrong because I didn't rob anybody or anything like that to provide for my habit. At the moment, about 3.5 years clean. I'm slowly dropping down on my methadone, and I'm working towards getting a job. With Paul's help, I've started running my own group here at Unity. It's not an easy thing to go through, and I thought I could take what I've learned to help other people.
I was in denial. No, of course I haven't got a drink problem, I just don't feel well. Stuff like this, and I just got worse and worse and worse. And then my partner was absolutely sick. He said, right, and he was crying, right, I'm going to have to do something about this. So he made an appointment with my doctor, unbeknown to me. My GP got me in touch with Janice, who's one of the workers here. And at first I used to lie to her and say I was all right. Anyhow, she got suspicious and came to my house one day, that's it, breathalyzed me, and I was drunk. I don't think you can cure yourself in a month or two. It takes a long time, really. But it flies. Once you are sober, you'd be surprised. The weeks turn into months, and it's great. That's why here is so good. You get with people who've had the same problems. We've all had the same symptoms one way or another. You can hear story after story, and they've all got links. You know, it's the same thing, different person, different scenario, but it's the same thing. And none of us would be here if we didn't want to be normal. The counsellors are experienced, they've seen everything before, but as I say, the brilliant thing is nobody's judgmental, and I come here to remind me of what I was like before I was well again. Slow recovery, as I say, and I'm still in recovery, but it's brilliant. My life is totally turned round. I've been very, very lucky and extremely grateful to this service because it's brilliant.
When the individual's no longer physically addicted but still needing support, we would look at what part of their recovery care plan that we can continue to help them with. So we try and get them really out back into the community. So we'd be looking at other support groups in the areas, within Penrith, and perhaps looking at NA, AA, and seeing what they could offer them. But if they would still like to engage with our services, we'd be looking at perhaps peer support, navigators, and trying to get them to go on to volunteering. So we would look at what we can offer, but also what the community can offer them.
Growing Well's a charitable social enterprise based on a farm just outside Kendal. We're an organic growing business, so we grow organic produce on 10 acres of land, and people volunteer with us to improve their mental health and well-being. We aim to provide a supportive environment where people can try out new things, relearn skills, regain confidence. We provide training to people as part of their placement with us, and lots of people move on from Growing Well into further training or into employment. And we're working with Unity so that people can be referred from Unity to Growing Well to support their recovery.
getting people back out into, you know, that recovery, out into the community, hopefully into sort of volunteer and paid employment would be the ultimate goal.